so much for watching the prenatal crash course. So this is lesson 2, which is going to be about labor and delivery. If you have not watched my first video about pregnancy, I highly recommend you to watch that as well. And if you haven't signed up for my prenatal crash course on mommydidyouknow.com, I recommend that you sign up for that as well, just because you can never be too prepared for the birth of your child. And I really want to make sure that you are prepared for you to care for yourself as well as how to care for your child. So first off, on this lesson, we're going to talk about stages of labor, what to look out for, and then of course we're going to talk a little bit about vaginal delivery, cesarean delivery, and some complications that might arise during your delivery. So it's a very exciting class and I hope that you enjoy it. So to start off, everyone wants to know, what are the signs of labor? I mean, when do I come to the hospital? So the first few things that I'm going to talk about are stuff like lightning, bloody show, water breaking. These are very important signs. So lightning is basically when your baby starts to move down. You might feel that pressure on your bladder and then it'll be like, oh my goodness. So that's lightning. That's basically your baby starting to move down. You might also have a bloody show. Bloody show is when you might have a little bit of blood on your pad, if you have a pad, or your underwear. Sometimes it has a little mucus plug as well. That can mean that your labor is imminent. If you have a little bloody show, it is important to talk to your doctor to see if they want you to come in. But if it is just a little bit and then you don't continue to bleed, sometimes it is just a sign of labor and you don't have to come in right away. But definitely talk to your doctor just to let them know that labor will be imminent and see if they prefer you to come in, especially if you have any risk factors for bleeding or miscarriage or anything like that. So the next thing that I want to talk about is your nesting instinct. So a lot of people, before they have the baby, they'll start wanting to clean the house. They might want to get everything ready for the crib. It's just in your mind, your body is getting ready for your baby. So it's like your mind is getting ready, your body is getting ready, pretty much everything is getting ready for your baby. And then of course the obvious one is your water breaking. Once your water breaks, it's very, very important to try to go to the doctor as soon as possible. They might swab you a little bit. It's called an amniosure. That's when they swab you to see if your water broke. But if your water breaks and you don't deliver your baby before a certain amount of time, usually about 18 hours, sometimes they do extra exams on your child. They might do infection screenings to make sure that your baby's not sick or anything. And then of course, regular and intense contractions are definitely a sign of labor. Sometimes you might have false labor, which are irregular. You can talk through them, you can breathe through them, but once they start getting regular and very strong that you can't breathe through them, you can't talk through them, you definitely want to head to the hospital as well to hopefully have your baby. So there's different stages of labor. Stage 1 of your labor is early labor to full dilation. So early labor, you have latent, active, and transition is getting into full dilation. So basically, you're latent, let's say you're in the house or something, and you might actually sit at latent for a long period of time. Actually, with both of my kids, I was at 2 centimeters for about a month before I delivered. So just because you start dilating does not necessarily mean you're in active labor. Active labor is normally from 4 to 7 dilation, so then you start heading to active labor. That's when most hospitals will actually admit you once you start getting there. And then transition is 8 until full dilation of 10. So at least you kind of have those stages in mind. So stage 1, active to, is early labor to full dilation. Then you also have stage 2, which is pushing. Everybody's different. Some people, they push for 30 minutes. Some people, they push for an hour. But it's very important not to start pushing until your doctor tells you to, just because sometimes you might not realize it. If you're not ready to push, you can tear, or your baby might not be able to come out as effectively as if you had pushed when your doctor was letting you know that you're ready. Keep in mind too that sometimes pushing is different for every kid. So like with my first, I pushed for a very long time. With my second, I didn't even realize the baby was out. We were doing practice pushing and I was just counting, and then before I knew it, I was getting ready to push again, and then the baby was already out. I was like, oh, the doctor was like, your baby's right here, congratulations. I was like, oh wow, what a surprise. So every baby's different, and don't be discouraged if you have to push for a long time with one baby. That does not mean that it's gonna happen again with the second. And then stage 3, of course, is one that a lot of people don't realize, is the delivery of the placenta. So just because the baby's out doesn't mean you're done. So once the baby comes out, you will have to push out the placenta as well. Usually the placenta, you don't really have to be like pushing it actively. It comes out by itself. If for whatever reason you have some placental fragments, be prepared. Your doctor might have to have some manual extraction of the fragments, which is when they take their hand and have to take some out. It's just, this might be very uncomfortable for you, but they might do that to prevent bleeding, postpartum bleeding and hemorrhage after you deliver. So it's very important. And then stage 4, after the placenta comes out, of course, is the golden hour. That's when your baby is gonna hopefully do skin to skin. It's after you deliver. You're gonna do your breastfeeding. You're gonna try to do some of your bonding to start that bond between you and your newborn. So it's a very important time. That stage 4, a lot of people overlook, but it's very important. But definitely you want to start skin to skin, and hopefully your first breastfeeding session within that first hour. So, but of course, earlier definitely the better. So the next topic, after we talked about all that labor stuff, is your pain management. I do have another video that goes a little bit more in depth with pain management, but just a basic run through. Your pain, you can, the first thing you can do obviously is breathe if you can. Sometimes as your labor progresses, it can be a little bit more difficult to breathe. One way that you can breathe is it's very easy, it's a 4 count. You go 4 and then out. But it's very important, if you do an ah or a moan or something, that you're not spending a lot of energy to do it. The reason is because as you're contracting and as your labor is progressing, every contraction actually decreases some blood flow to the placenta, just temporarily. But what you want to do, the focus of your breathing, is to bring oxygen to your baby, because it's very, very important if you want to make sure that your baby is healthy. You don't want to use all of your energy screaming. You don't want to use all of your energy, cussing out whoever and your family members over here. Actually, one way that's very, very important is try to make sure that the ambiance of your room is good, that you prefer not to have certain people. Make sure to tell them. You can tell your hospital staff. As a nurse, I have no problem just being like, hey, she needs to rest or whatever. We got your back. Just be open with your healthcare staff. Be open with your family, and it'll be a lot better in the end. All right, so we have your breathing. This is important to increase oxygenation into the placenta for your child. The other pain management technique is definitely to a lot of people, they do IV pain medication. These are like narcotics, like you'll have your Demerol, your morphine, your Nubain. One thing with narcotics, obviously, is that some people get nauseous from them, some people have vomiting, but it is fast acting. It does not take the pain away, but it kind of takes the edge off a little bit. So I did try to have Nubain was the medication that they did for me in the IV with my first child, and I don't remember anything. I don't remember anything after having it, just because I don't really react well to narcotics. So after that, with my second, I did have an epidural. I had an epidural with my first too, but after like 18 hours of labor. I'll tell you all about my labor delivery another time. But with my second, I was like, I'm just gonna go straight to the epidural. If I'm 4 centimeters dilated or more, just go ahead, put in the epidural. Everybody to each their own. One thing you'll notice, if you do get an epidural, they might give you 1 liter or 2 of fluids first, just to hopefully stabilize your blood pressure as well, because epidurals sometimes do decrease your blood pressure. So that's one thing to note. And also another side effect of epidurals, although it is rare, about 1% of the cases do get spinal headache. So if you find yourself with a headache that you can't really get rid of, you definitely want to talk to your nurse and your doctor to hopefully help that out, because those are not very, very fun to deal with. After you have your baby, you might have some shaking, especially if you had some narcotics, you might be shaking a little bit. They might give you some warm blankets, which is great. You definitely have some postpartum contractions as well. Every baby that you have, you'll probably have a little bit more contractions than your first, just because your uterus is working a little bit harder than it was before. So they'll also be giving you some Pitocin. Sometimes they give the Pitocin after you deliver. That just kind of helps to prevent bleeding. Pitocin will cause you to be a little uncomfortable with the contractions as well. Just make sure that you keep your bladder empty. That is the best thing you can do, is keep your bladder empty. What you'll find is if you need to pee, your contractions are going to be a lot worse. You might notice some mood swings because your placenta was your hormone factory. Then all of a sudden it's gone, and then your moods are going to be kind of all over the place. Just make sure that you have your support system, and they'll really kind of help to keep you level with yourself. And then of course you will have period-like bleeding, which lasts anywhere from a few days to a few weeks. If you do get blood clots kind of the size of your fist or bigger, kind of like golf ball size clots, you definitely want to talk to your doctor about. And then of course if you saturate a pad in 1 hour, that is considered heavy bleeding as well. Of course, there's so much about labor and delivery, and I can't possibly go over everything in just one video, but I just wanted to do a quick run through about things that you should expect. I also wrote a wonderful article about what to expect when you are having a baby, and it's on mommydidyouknow.com, and the link is on the description as well. And I hope that you enjoy this class. Make sure to subscribe if you have not already, and you can always share the videos with your other friends and family. Thank you so much.